Alan, I'm assuming that's your audio that's on there.
That's my phone. Yep, that's me.
I'll change it.
I'm glad you're good at that, Corey.
No problem. So I set up Zooms to auto record, so it's already recording. But
yeah, that's what they told me when I first signed in. It was being recorded already.
then I don't forget.
Okay. You don't forget much, I don't think, do you?
No, but I have so much on my plate right now.
I don't doubt that a bit. I was kind of surprised to see you at the law enforcement deal from. Are you a member of the Optimist?
No, I'm a police canine board member. I'm the vice chair of the board.
Oh,
and we were the
great.
recipients for the raffle.
Right. Yeah, they do a great job. I'm very impressed with them.
They did do a good job. Hello, Alex. Nice to see you. Hi, Tennille. Nice to see you on here.
You too.
Eric keeps moving. Eric, I'm going to change your name on here.
You can do that?
I can.
Good. I don't know how.
You hit the little 3 dots, and then with the pop-up menu, you choose rename.
Oh, good job. Okay. Hey, I didn't do a thing.
Hi, Shelly.
Hey, she does mine all the time, Eric.
And Doug is on here. Hi, Doug. Do you want me to change yours, or can you change your name to have your first and last name showing? Me or you? You. Got it. When I download the report, it's easiest if we have first and last name just to show attendance. So we usually wait just about a minute or so as people are still coming on, and then our chair, Ellen Hobson, will start our meeting. Ellen Janelle is absent, so we will not have a report from her regarding the Housing Authority.
Okay, let me write that down or get that marked in there. Okay.
And if someone does not attend on behalf of the Navigation Center, I did take notes when they spoke at Shelley's Homeless Commission meeting.
Okay. And the other thing you mentioned the other day was, well, that was what you mentioned the other day about coming up. Yeah.
Yes. And Dane may not be present also. He's doing a
Do you
health
have any statistics for him?
I do. I'll find his email real quick.
Okay.
The only one I do not see yet is Teresa. She was going to talk about WorkSource.
Well, maybe she'll come on. We'll go ahead and get started. Maybe she'll come on and we can pick her up. Work source comes a little bit later, but maybe we can go ahead and get started and hopefully she'll come on because sometimes we get people coming on 3 or 4 minutes from now. So we'll go ahead and get started. I think I'll call the meeting to order for the Behavioral Health and Housing Subcommittee meeting. First order of business is minutes of January 28th. You'll have them. Somebody wants to approve the minutes. Anybody? So I have a motion to approve the minutes from January 28th.
Sure.
I make a motion to approve minutes.
Thank you. Do I have a second?
I'll second.
Thank you, Robert. Did you get that, Corey?
Yes.
Okay. Motion made and seconded to approve the minutes from January 28th. All in favor, either raise your hand or say aye. Aye.
Aye.
Anybody opposed? Okay, motion passes. Thank you. We'll go on to the next order of business, which is the connecting point update. Dane is not here, but Corey said she has some of his statistics.
I do. So for Connecting Point for January, let's see. He said they had some supplemental events such as point in time count, Hope Court, and daytime warming center. So total served were 575 people. And there were 221 males, 195 females, and 159 unknown. For age range 18 to 30, there was 1, 31 to 50, there were 43 people, 51 to 64, there were 39, and 65 plus 8. Just to remind you, they don't always have the ability to capture ages, so that number is not going to total the amount served. Let's see. So in duplication, they were able to view 175 clients that had ID and 143 unduplicated clients. 81 were men, 59 women, 3 unknown. Services provided, they had 70 showers and 52 of those showers were unduplicated. And it looks like we had more shower trailer issues and it's been down since late January. And then for the Hope court team, so we had a drug court project on January, I think it was 16th, where we had a lady come and provide a hot meal and some warming items during Connecting Point at the Opioid Treatment Center. And they were able to provide 72 meals and 50 bags of winter warming items. During January for agency supplies, they gave out 227 wound care kits, 218 naloxone, miscellaneous resources such as blankets. They provided 198, 184 socks, 150 food, 109 smoking supplies. Neck services were 93, fentanyl test strips 71, condoms 64, pet food 59, hygiene and sanitizer kits 49, and HIV syphilis testing 7. That is all the stats that Dane had provided for me.
Okay. Any questions for Corey when she provided Dane's statistics? Do we have any, with Dane not here, probably don't have any idea how long the shower trailer is going to be down? I know it's a big draw.
Yeah, I don't. I can ask him later and see if he can let me know before I send out the follow-up documents to this group. Because I usually send a follow-up email providing Cheryl's information and Dane. So I'll ask and see if he knows that, and then I can add that in the email.
Okay, thank you, Corey. Yeah, that shower trailer I think is a big part of their what they provide, and it's been very popular. Okay, moving on. Cheryl with the ADAPT Integrated Healthcare Program highlights and the successes. Cheryl, are you? Yeah, I see Cheryl's ready. So go ahead, Cheryl.
All right, so I'm going to talk about the programs under the crisis department for ADAPT, and I will start with impacts. So taking a look at Q1, we have updated our cohort list, and our newest number is 675 individual cohort members in the impacts program. Of those 675, there are 134 individuals who are currently meeting that admission criteria of 4 or more incarcerations in 1 calendar year. So the focus of our services is really on that 134 people. We have a new success story that I'll share with you all real quick. So subject 507 is a current cohort member. So they were admitted to the cohort in May 2024. And so from May 2023 to May 2024, they had 6 arrests, which qualified them for the cohort, and they had 13 hospitalizations. And so of those hospitalizations, we're talking about using EMS services to get to the hospital. So quite a large expense there. During the first couple of months of engagement with impacts, those numbers were stable. However, that individual lost their housing this last November. And if we think about what the temperatures were like in December and January, they were bad. And so the individual during those 3 months of being unhoused, their hospitalization skyrocketed to 19 emergency room visits. And so the impacts team was able to step in and do some really careful care coordination with all of the different providers, because all of the different providers are all doing their own unique tasks for this individual, but they're all working in a silo. They're duplicating services and not working together. So by working together, getting everyone at the table for care coordination meetings, we were able to resolve that individual's issue that led to being unhoused and get them back into housing. So now that they're housed again, they've been housed since about mid-January, and we've had 0 arrests and 0 hospitalizations. So that is amazing. So the resolution rooms, so far in Q1, we've had 28 stays for 13 different individuals. We're seeing still kind of the same type of admissions for those. Because we're on the I-5 corridor, we get a lot of people traveling from out of area, and a surprising number of people who have some form of dementia or Alzheimer's. And so we had another individual coming through the area who got confused late at night, left their home, got in their car, drove, and found themselves here in Roseburg. We were able to safely house that individual at the resolution room until their family was able to come and pick them up. So some really good resolutions with that. The majority of our folks there are using, they're getting peer support services. We're supplying them with food, hygiene order, naloxone, safety planning, clothing, anything else like that that they might need. Mobile crisis has continued to be super busy. I don't have Q1 numbers because I only pull those at the end of every quarter. But I do have an update on Q4 for last year. We had 650 total calls. 530 of those calls required an in-person response, and 120 calls were able to be resolved over the telephone. I will have one of those lovely handouts from OHSU that shows our demographics and our data and the numbers. I should have that available to distribute on March 14th. So I will send that out to the group. In that same quarter, we had 39 youth who received a mobile crisis encounter, and then they were admitted to stabilization services after that mobile crisis encounter. And that's a period of 8 weeks that we follow that youth and their family. And we work not just with the youth, but the whole family system to see where we can help to stabilize the family, hopefully preventing any further crises from happening. And the sobering center in Q1 so far, we have had 41 sobering center admissions for 21 different individuals. So we have one individual that so far in the last couple of months has had 6 different admissions. We have 3 individuals who have each had 4 different admissions. 2 who both had 3 admissions, and then 2 who both had 2 admissions. So we do see a lot of repeat clients coming through. We don't mind that at all. It gives us those extra opportunities to really develop some recovery language and resources for people. And sometimes it just takes a little while to build those relationships. So we're very happy to do that. I have some additional numbers that I'll send out to Corey for you all to look at, but if anyone has questions, I'm happy to answer them.
Yeah, Cheryl, I'm always amazed at the number of special mobile crisis and also the sobering center. The sobering center with the repeat visits, those are people that hopefully we can move forward with some rehabilitation services. I assume you mentioned that already too, yes.
Yeah, and I think that's the biggest difference between the sobering center and the jail facility. So I walk into the sobering center and I see peer support sitting on the floor outside a cell, talking to people about recovery and what their process looks like, what our options are. And so no matter how many times it takes, we're happy to do that. And it gives us those opportunities to really develop that relationship. And even if they're not ready at that time, they're taking that information and that relationship with them, and that's perfect.
Yes, I agree. Any other questions for Cheryl? And I appreciate the numbers you share, and when Corey sends them out, I always share them with whoever I need to also. Thank you, Cheryl. So we don't have Lindsay Holcomb with Mercy Medical, do we, Corey? I don't see Lindsay up right now.
No, but
So we'll
first I just want to note we had a slight change with the agenda this time, where we're added a roundtable option for behavioral health. So if there's anyone on here that is in the field with behavioral health, if you have a quick update, I can provide that now. I didn't know Doug Ladd was on here. Is he still on here? See his name, or Jesse?
Yeah, I don't see.
Well, sorry.
Oh, go ahead. Go ahead.
I don't see either raising their hand, so we can go ahead. Sorry about that. Just want to make sure that was noted.
Okay, no problem.
Providing an opportunity.
Yeah. Any other for behavioral health issues? Definitely, if you have something you want to share as part of the roundtable discussion, go ahead and step right up. Otherwise, So I don't see anybody's hands or any up. So let's move ahead to the housing updates. And Corey has something about the Gary Leaf Navigation Center.
So I didn't hear back from them for the agency, but I watched the Homeless Commission that Shelley Briggs Loosely, she's a city councilor who chairs that commission, who's on our meeting today. So thank you for joining. So what I heard during the meeting, it was Holly Fifield, the Director of Housing Stabilization. She reported that in the last 6 months, they housed about 115 individuals, which is children and families, men, women, whoever needs the services. They successfully rehoused about 15 individuals into permanent housing placement, reunified over 5 families with family outside the area, and transferred about 5 individuals into in-treatment programs for drug and alcohol services. They provide 3 meals a day. They have 10 pallet shelters still outside and can hold up to 35 people inside in their congregate shelter. So she said they were currently completely full, and their wait list is at 396 people. They work on case management services such as IDs, lessening barriers, and getting people into housing to help them find the tools to get employment and reunify with their families. They work on getting them clothing and haircuts to help them with employment needs. They have people on site 24 hours a day, including security when needed. And it says a goal of the center is for positive outcomes. And the warming center was also provided by UCAN for 22 days this year for this season, and the coldest days they averaged about 25 people. Did I miss anything, Shelley? Okay. So that was the update. Sorry, you're on mute. Okay, can't unmute. She said it was good. Okay. Also, Gary's on here. If Gary had anything to add, the police chief for Roseburg, but those were the main notes that I took from the meeting.
Yep, I don't have anything to add.
Thank you.
So Corey, now the navigation center, this is still transitional housing, isn't that correct? Or is this,
Yes.
or how, I don't know how transitional, how permanent these become. Do you know?
I know it's not permanent, it's transitional. It's meant to help people on a short-term basis. Some folks in the pellet shelters I know have a little longer stays than the inside, but unless Gary or Shelley know, I don't know the exact length of time they're allowed. I think it's probably dependent case by case, but they work their hardest to try and get them into other housing options or with family or set up in different spaces.
Okay. And that waiting list is amazing.
Yeah,
You said
it's a little
356.
396. It's a little lower than what it was in the summer, but still really high.
Yeah. It shows there is still a tremendous need for housing in the area. There's no doubt about it.
Yes.
Okay, thank you, Corey. Any other questions for Corey? Is she with the Gary Leaf Navigation Center? Thank you, Corey. Thank you for going to the meeting. So Janelle is not here for the Housing Authority of Douglas County. We don't have anybody else with HADCO, so we'll move forward to any other roundtable updates from housing people that are here that can provide housing updates.
I don't want to
see
put
the Oxford
Sarah.
House is here.
Yeah, I don't want to put her on the spot. I know she's traveling, so she can't have her camera on, but I was curious, she can unmute and just give a brief update that she did to me via email.
Yeah. Hi guys. Thank you for having me. I don't have a whole lot of statistical information, but for what I do have though is Douglas County. We currently have 12 Oxford houses. We are losing one of them, and it just so happens to be our reentry house. So the house works specifically with parole and probation for those incarcerated coming out, an AIP or trans leave type things. So it would be a huge loss, but I'm working really hard to replace that house. And additionally, I'm looking to open 2 or 3 more back to back to back. Probably men's house, and then hopefully I can find another women's house. So the houses currently are plumb full. There's waiting lists for each one of them. But I am avidly working to open new houses, so soon to come. That is all.
Thank you. Yeah, well, great. So the house you're losing, you said, is the primary reentry house. Is that correct?
Yes, the one reentry house Douglas County has.
Okay. Now that's kind of a loss, isn't it?
It is, and they house 11 people. Yeah, so it would be a huge loss. Huge hit.
Thank you for the update. Do we have any other housing updates that anybody can share with us? Okay. Moving forward to our presentations, Douglas County Jail MAP program. Tennille.
Hello, everyone. My name's Tennille. I'm the MAP coordinator here at the Douglas County Jail. The program is still pretty new to us. We're doing our best to get everything in order for that. It's going really well so far. I don't have a lot of statistical information, but I do have currently, I have 6 on Suboxone and 9 on methadone. So a little bit about our program. It's meant for those with an opioid use disorder. When an adult in custody comes in, we do their screen and medically clear them. And if they should say they use opiates on the outside, that is where we put them on a detox protocol and monitor them for 5 days. And if they are having a really hard time and their scores are high, from 8 to 20, and they're like 13, then we're gonna get them started on a Subutex 4 milligrams for 3 days, and then we'll increase them up to 8 milligrams after that third day, and just start them on our program. So after that, they fill out their paperwork and we get them started. And then if they're going to be released in a couple weeks, I set up with Rochelle Capone, our discharge planner. We get them a re-entry spot through ADAPT with the provider. So they have someone to go to when they get released, to follow up with their care, in hopes that this will help them from overdosing on the outside. We also do continuation with Suboxone here. So if someone comes in with a current prescription, then we would continue that treatment for them for their stay. So, yeah. Any questions?
So this program is sounds like mostly for long-term stay, or is it, or the ones that get turned around in a couple, 3 days, or can you still help with them?
Well, yeah, most of the time, it is by the time that we get to the patient, and that, like, if they're here for 3 days, it's not usually quick enough to get them started that quick, unless they're, if their vitals are, terrible and their scores are high, then they're going to be started as soon as possible. But majority of the time, it's someone that's going to be staying here for a couple weeks or longer.
Okay. So the ones that are there for a couple weeks or longer, then you can get them started. Do you know what is the program been going on long enough to know what the outcomes might be, if it's how helpful it is?
So so it's been helpful on the inside as far as I know for them, but I don't know about as far as when they get released. I don't feel like there's a lot that actually follow up with their aftercare appointments, which is unfortunate. But we do the best we can to get them set up for success for when they do get discharged. And then it's up to them to continue with that.
Okay. So I'm guessing then that also, since you're checking these as they come in, but you're mostly working with people that are going to be there a while, do you have any guess as to how many of those coming in that are going to be there a while do need some detoxification?
Right now, I've got probably about 3 people that are claiming to be on a detox right now. So that would be ones that I'm monitoring their vitals and their scores, and speaking to the provider, and seeing what we want to, if we need to start them. But it's also, it comes down to a lot of, are they abusing, other drugs? Like, say if they're coming in and we're continuing their script for buprenorphine, are they abusing other drugs as well? So that's something we look for. It's like, are they really using this for the right reasons, or are they just using it just to get high? So we're
Okay.
yeah.
So now I think you mentioned, how long has this program been going on?
I think is it August, Corey, or somewhere around there?
Yeah, we applied towards the end of summer last year. We just got our first, I think, our first funding check at the end of January. The program started slightly before the newest grant that I received from the Criminal Justice Commission. But the grant that I received was helping fill in the gaps for funding needs. Originally, this was through the jail. And so my grant was to help fulfill it so we can have Tennille's position more dedicated for this.
Okay. Thank you.
We're learning
Tennille.
every day.
Any other? Yeah, I'll bet. Is there any other questions? Any other questions for Tennille? Okay, I appreciate it, Tennille. That's and it's you know, and I'm hoping that this takes off, because definitely, I know just from my limited knowledge, it seems like a lot of those that goes back and forth through the jail definitely need some sort of help when they get in, especially the long-term care that they need.
Absolutely.
So,
And
thank you, Tennille.
we have we can start 15 people. That's like our max. So hopefully within, more time, we'll be able to add more people as well. So that'll be very nice.
Thank you.
You're
Any other
welcome.
questions for Tennille? Okay, moving forward, work source, Teresa, you're here and I see you're ready to go.
Yes, and I have a little PowerPoint of what we offer, if that's okay. I'll share with you guys.
Sure.
It says send request. Do I send request? Has been sent. Do you have to allow me to share? Is that how that works?
I just clicked allow, so it should be working now.
Okay. I don't. Okay. Bear with me. You guys are my first. This is the first time I've done this. I'm not gonna lie.
If you click share,
That's your
but then
phone,
it will pop
Teresa.
up all your different windows of what you have
And
open. So
which-
choose your PowerPoint.
Okay. Okay. So I know. Is it showing my PowerPoint
I'm
now?
ready to. It's thinking.
I want to start
There we go.
There we go.
Okay.
It's
And then
up.
you just go to your slideshow and say from beginning, then it'll make it bigger.
Okay, perfect. Okay.
Okay.
Is it looking okay? Okay.
Yep, that works.
So at WorkSource, we help people try to find jobs or careers. And with this presentation I have, it kind of just put bullet points of what we do. So we have office equipment and resources for them to come in, and people come in even, we always say people come in, even homeless will come in just to get warm or whatever, but we always say they might accidentally leave here having a job. We always say that, which is, I think it's kind of neat. So what we have for resources, we have the computers, job search templates on our computers for resume. We've got a copier, fax. We have a phone. We do get people to use our phones. And then my next slide, access to training. As far as the on-the-job training, we have partners in our office, like we have South Coast Business that gets grants. And then we have, for example, even Easter Seals, 55 and older, that people could do their program. So back to like South Coast Business, and the on-the-job training program does change. Typically, it depends on what the needs are as for employers here in Douglas County. So what they do, and also another one is Epic. They target the age, and don't quote me, I think it's 16 through 24, 26, and try to work with employers in our area to see if they would do their program to take these people on the job training. And what happens is they pay for their wages. So that just gives you an idea. We also help with the NCRC testing that Wooly does, but we register people for that, which is National Career Readiness Certification. So it's nice that people like would like to have that on their resume. It looks good. At one time, I know Roseburg Lumber really looked at that, so I'm not sure if that's still in place. Doing mock interviews here, short-term training programs, certifications, internet email. People do. We have different clinics here. We call it clinics or workshops that we provide for folks. Like every Wednesday, we have a basic computer class, but also she helps people do like job searching, create a resume or cover letter, just in if there's any other type of computer skills that people are looking for, because sometimes when you're applying for a job, they're asking you to be proficient in certain kind of computer skills, and she'll help people navigate through that. So we have staff guided assistance. If they're on SNAP, we have the STEP program, which is one-on-one, we're coaching with them. And also with that STEP program, if they qualify, they're on SNAP, we can help them like an interview close, or if they get a job work close. Also transportation, we try to look at that to see if that's a barrier. What we do is we address their barriers when we first meet with them and kind of see what would it take to help these folks to get a job of any sorts. So that kind of gives you an idea. And then here's our workshops, and we have flyers, interview, resume, basic computer skills, job search, application clinic. We have found that people, when they go to apply, there's questionnaires or even tests sometimes they have to take. So we offer this. We've got 2 staff people that staff it, and it's helped people get over that barrier. Like if there was a questionnaire when you're first applying for a job, even like, I think, is it Applebee's had like a little questionnaire. It's a little chat bot that people had to answer and stuff. It was interesting to me. So also, one other online workshop, the state of Oregon had to apply for state agency jobs, working through that program. And that's online. And then right here, how do I sign up? You can register. They have iMatch Skills. We use Quality Info. This is another website that's really good for people for occupation and wage, but also job searching. Oh, and we also we offer the LinkedIn program, and if people want to sign up, they get free the LinkedIn program, but not the full program, but we would go over it with them. We have a team that's set up to help them with that. And they found, to try to give them a tool to help them get back to work. And so this is your local WorkSource team. So like I said, South Coast Business, Easter Seals, they are here to work with our veterans. We don't have our other Easter Seals, but they're in Eugene. They come down here and do meet with people. We still have that 55. So Easter Seals has 2 different programs, one that works with our veterans, and then one that is works with 55 and older. And then we have, for our disabled vets, we have Chad. He specialized working one-on-one with them. And Epic at 16 through 24. So I was wrong about the age. I think that's it. So I'll stop sharing. So that just kind of gives you an overview. Does anyone have questions?
I have a quick question. So
Yes.
you work with matching their skills and you help them with jobs. So I work with a lot of folks that have been incarcerated, obviously through mental health and drug court programs. Do you have people specifically that works with them, with those things on their background to help them better match a place that will overlook it or consider it based on meeting them and learning who the person is?
100%, we do. And so WorkSource, we don't have it right here, is working. They're in the prisons, I believe in Eastern Oregon. I'm not sure. It's a pilot thing that they're doing, having WorkSource us in the prisons to help people when they're getting out of prisons to kind of prepare them. But yes, we work with people all the time. We tell them, come in, and they're on parole and probation. We're like, here, show your opportunity plan. Because we do an opportunity, if they get on the STEP program, we do an opportunity plan. It's like, And it's very structured as far as dealing with the different issues that they might need to overcome. We try to focus on that to remove the barriers. Have you seen that hierarchy of employment? So the bottom part of it is, and we all know, housing. And we deal with a lot of our homeless, and we try to get them housing, but jobs too. Even if they're, we still, I mean, we've had people that still get jobs. We still, you know, we um we still do that. We try to find all the services that we have in our community to do wraparound services for them, to get them to remove the barriers. Kind of what we say is like we're the bulldozer of your barriers. We remove it to so you can move forward to getting a job or a career.
Thank you. Yeah, go ahead, Catherine.
Hey, I appreciate the opportunity for folks to review and work with coaches to remove barriers. I'm curious, in the programs that y'all offer, are there aptitude testing and skills inventory that occurs during people's relationship with your program?
So we do have like a career assessment that they can do. So everything is it's all by their choice. It's like a buffet. We lay it all out, but we tell them these are your options. We have different things that they can do. But at the end of the day, they have to take the plate, put the food on, and eat the food. And that's what we tell them. You pick and choose. And I tell them, you're the captain of the ship. So, what is we have seen, so even we address education as far as if you want to get your GED, we try to meet folks where they're at as far as that goes. Some people don't like to go in person to do, like, for an example, for a GED, we found a GED website that we can pay for them to do it virtually. So I'm not sure, did that answer? We put the tools out there, but we let them decide on what they would like to be tested, use the testing for. Does that answer your
What
question?
I'm curious about is skill sets. Like someone might have a high aptitude for manual dexterity or spatial relations, or someone else may be well versed in reading and literacy, where another person may not be so skilled in that area. Is there that kind of review that happens?
It's not an actual test. It's actually us. I know what you're saying. And that's a struggle, right? Like you're trying to figure out where that's through the coaches. That's through us meeting one-on-one, having those conversations, trying to peel the onion back per se, I guess. And that's an ongoing thing. As far as we're always getting trained on how to help individuals because a lot of times people aren't going to just say, like for an example, I can't do this, or I don't know how to read, or I don't know, people don't come forth with those type of things, or I'm good in this area of my life. So they try to train us to try to have conversations for people so it's based on them telling you, but we don't actually have like per se a test for them to take for us to see where they're at. Does that make sense?
Yes, it makes sense. Thank you.
Yes.
So Teresa, I know all you're sharing the screen sharing you did. The EPIC program is for 16 to 24. Does
Yes.
that mean that a 16-year-old that is kind of at loose ends can come in and get some direction?
Correct. Yes. And Phoenix School is where we do have one housed here. Yes. Yes. We can hook them up. Yes. 100%. Yes.
And also, it looks like you also can help people that are trying to, other than the initial employment that they get, they can upgrade their skills even if they're already employed doing something.
Yes, that is correct. Yes. Yes. If they would like to say they have it in retail, but they want to go in the medical field, we can do the like if they want to become I mean, we've certified people to become medical billing and coding, phlebotomist, pharmacy tech. Trying to think of CNA, and we've kind of supported people, but that's kind of changed. That was doing the RN program at UCC, but that's changed, so that's probably not a good example. Yes, and that's with South Coast Business. They have a list of what they can do to pay for, what they can
Okay.
pay for certifications.
Okay. Okay, thank you. Any other questions for Teresa? Very, very good presentation, and I think those are very, very, very needed skills that you can teach, and people, I'm sure, need them moving forward to get stabilized, not just housing, but also then getting a job and being able to stay stable.
Yes,
Very
and
important. Thank you, Teresa.
maintaining it too. And we do work on people's soft skills. I was just thinking about Catherine's question, and we do have a program that we pay for. It's virtual, and they can even use our computer to help people with soft skills. So soft skills are just, just like when they get a job, and for them to keep the job, we want to, and that's like interaction, or how you talk to your supervisor, your manager, and how you respond. Or we do have that too. We work on. We're actually looking at, because soft skills we're finding with employers is a big problem. So we're looking at trying to see if we could actually get one of our partners to do in-person soft skill course for people.
I'm guessing also that getting people to be not only be stable in their lives, but also to show up to work on a regular basis at the regular time, at the time they need to be there.
100%, exactly. Yeah, we work on that so that we want them to be successful. And we work with employers too. I don't know if that put that in there, I'm sorry, but we work with employers. We have a department, Chardell, she's fantastic, goes out into our community, tries to meet employers and explain to them what employment has to offer. As far as she could even screen people, she would interview them and screen them and recommend them to interview them and see if it would fit for their culture and what they're looking for and their needs.
Okay.
And it's free service. So.
Thank you.
Thank you.
You bet. Great. That's the best part, free. Thank you, Teresa. So there are no other questions for Teresa. Moving on to our roundtable updates, and Corey has disposition calls for service.
So I sent a copy out with the agenda, and I just sent the copy of what I received from the sheriff's office. I didn't do the chart yet, but moving forward, I'll have the chart comparison for everyone. So as far as calls, Cow Creek had 0, Douglas County Sheriff's Office had 7, Myrtle Creek none, Roseburg 8, Sutherland PD 2, Winston none. So there are 17 total. Reports taken. It looks like the only agencies is the Sheriff's Office had 1, Roseburg PD had 1, and Sutherland PD had 1. No arrests were made. So that's still a good thing. And as I've mentioned several times over month to month, because our mobile crisis call volume keeps going up, we're seeing the call volume to 911 go down for mental health concerns. And that's how we want to see it. We want it to go the right avenue, which it seems to be. Any questions from that?
Yeah, that the fact that the mobile crisis calls are going up and the 911 calls are going down, that shows that the program is working. That's what we wanted to do that's what the program was meant to do. That's great.
Well, as I said last month meeting. Oh, sorry. Who talked?
It was Sarah. I was just commenting that that's fantastic.
Yeah. Well, in January, I reported we had over 3,100 calls to 911 in 2023, but in 24 we only had, I think, 267. So that's a major difference in how people are utilizing the program that they're supposed to.
Absolutely.
Before I proceed with anything else, I just want to give a quick shout out to Alex. He's the new director with the Umpqua Valley Public Defenders, and we're going to be voting him in as an official council member with Lipsick at our May meeting. So welcome. Thank you, Alex, for attending today. And then Shelley Briggs Loosely is newly attending. She's city councilor for Roseburg and also the chair for the homeless commission. So I appreciate her coming on today as well. I do want to say last Friday, I went to the Painted Horse Recovery Open House, which was great. They're at 1941 Northeast Stevens, which is in between the new Douglas Electric building and the old ESD building. It's next to the mini mart there. And they did a phenomenal job updating and making that space beautiful, usable, great attendance, full room. They had to drag more chairs in. Fortunately, I was called up last minute to say a few words, but I wasn't prepared for a speech, but that was fine. It was great. I talked about Lipsick and the programs that we have and that we look forward to working with their community to intermix with all of our services that we have as well. Last Friday, I also attended the Respect for Law banquet that evening. I saw some folks that are on this call as well there, which was nice. So we got to celebrate officers or deputies or dispatchers of the year from different agencies, which was great to see. I do want to say today we have our pitch panel for new folks in our drug court graduate phase. So there's 8 folks trying to graduate. We have 3 women and 5 men. Once their pitch is approved this afternoon, then I work with them to move forward on their community projects. So I've already been working with them on formulating their ideas and who we can talk to and partner with. So I'm excited on some of our upcoming ones. So I'll have more information at next month's meeting once I know for sure people are have a yes. I don't want to share anything yet without getting Judge Johnson's approval. And then this coming Thursday evening, I'll be with Robert Wilson, who's on the call with the mental health court group. And we have some folks in that program that will be participating in Thrive's shopping tour. So what Thrive does is that they work with us and they provide a tour to explain nutritional things people can purchase at the store, how to shop on a budget, what to look for that's better and more sustaining, that's maybe more shelf life, you know, longevity than other items, proving the point that Quickie Mart food, you're going to spend so much money quicker versus that same amount going to the store and buying good things for yourself to sustain for a week. And so they have handouts. Everyone gets a little folder. He does a great job answering questions. And we walk, we meet at Sherm's and we walk through the produce area. And then the first, I think, 2 or 3 aisles, which has a lot of the bulk and organic and good food, because we're trying to promote better eating. And he looks at it as food is like medicine. So what we're ingesting is to help our overall health and well-being. So that's coming up this week. From there, we're hoping to get some cooking classes started too for the mental health court group and purpose workshop. I think that's all I had. Other than I did see in the chat, Sarah from Oxford House did ask that if people didn't mind if you could put your name and email so she could pull it from the chat, and that way she can contact anyone to discuss services. If anyone would like to do that. That's all I have. If others want to speak.
So Corey, is the next drug court graduation date been set yet?
Yes, that'll be May 13 at the fairgrounds. It'll be back to a Tuesday. It was a rarity. We had it on a Monday in February, and it was just because the fairgrounds was booked. So Judge Johnson prefers it on a Tuesday. It's a little easier to remember than the first day of the week.
Very good. I prefer it on a Tuesday also.
Yeah, it does interfere. You had city council meetings, so it does interfere with those types of meetings. Yeah, May 13th.
Yeah. And I certainly, Corey mentioned the law enforcement dinner that we had Friday night, very well put together. Very appreciated the Roseburg Optimist Club for putting it on, and it was a great tribute to our law enforcement partners. So thank you to them. So we have one other Painted Horse open house flyer, Jesse Spain. Oh, Jesse, are you still here?
That was the event that was last Friday that I mentioned that I attended.
Oh,
It's
okay.
just informational, so it wasn't a discussion item. It was just added. But if Jesse wants to talk about how it went, he can.
Sure.
Yes, you, Jess. You're on mute still.
Hey, good afternoon, everybody. Sorry, I had to take that call. Yeah, we're really excited. Corey, thank you so much for speaking. I mean, you really tied everything in and brought it home. Everybody thought that you were great. You did an amazing job. Yeah, Painted Horse, we're excited about being in this community and helping our community and doing whatever we can to support our people. Yeah, it was a great event. We had, I think we served food to 130 people and had over 150 people who attended. Yeah, it was absolutely an amazing event. And so I invite anybody to come down if they want a private tour. I'm here like 9 to 6 every day, usually later. Our hours are from 2 to 10 technically, but I'm here, like I've said, in the morning doing whatever I do. And then, so anybody can come by at any time. We're located at 1941 Stevens. And yeah, come by and take a look. Thank you.
Thank you, Jesse. I saw the news report of it, and it looked like very well attended and a great kickoff. And I'm sure you're looking forward to helping in the community, and it's a great thing to have going on. So thank you, and thank you for Painted Horse Recovery.
Awesome. Yeah, it was a great article. Thank you.
Is there anybody else want to give any updates going forward? This is a time to share what you're doing and enlighten all of us about what the programs you're carrying on. Okay, seeing nobody's hands in the air, our next meeting is Tuesday, March 25th, same time, same place. And I appreciate all of you for attending and sharing what you have going on, because it helps all of us going forward. So thank you very much. If nothing else is going to be needed to part of the meeting, I'll go ahead and adjourn it. Thank you, everyone, for coming.
Thank you.
Thank you.